Hi, my name is Ricardo Jackson, CEO of Campbell Health Solutions. I just wanted to hop in here before the show begins to let you know about our Tuesday late night clinic. Basically, it's every Tuesday from 5 to 9 p.m. by appointment only. We do HIV testing, primary care, wellness checks, STD screening, and treatment. So just give us a call at 561-208-6595 to schedule.
Well, hello, good evening. Welcome to Positively Positive. I am your host, Susan Lee Mintz. Oh, do we have a show for you tonight? We have a little Latin in here tonight. Oh, wonderful gentlemen, but I can't tell you any more than that right this moment, but I'm very excited. Now, Positively Positive, for those of you who do not know, and you are to tell your friends if you do know and you're everybody else. We are a show dedicated to promoting HIV/AIDS awareness through organizations, stories, people, facilities, anywhere. If you have an HIV/AIDS component, whether it's somebody you lost, whether it's somebody living with HIV, whether it's, doesn't matter. All over the country, people have called in and we've had them on because there's some aspect of their life, whether they work or whether they're volunteering or whether they're doing startup organization. HIV is this show. Positively Positive is removing the stigma of HIV and AIDS, one program and one story at a time. So check out Positively Positive, all the podcasts at Campbell Health Solutions or on my website, susanmintz.com, and you will know what we are doing and meet some of our amazing guests in season 2. Tonight, we have a gentleman on from Cuba. And I can't tell you his name yet, but he is a care coordinator supervisor. That's a big title. A care coordinator supervisor with the Department of Health in Palm Beach County, where we live. He is, I said, a Cuban. He's a musician, a photographer, an author, fellow author, storyteller, and a man who truly has the heart to care about those who have HIV or AIDS and to get them to the right facility. But he's a care coordinator, and I want to know so much more about that. So, ta-da, the glasses come off, and I say, Yolexis Pina Ramirez, come on in. Did I do good with your name?
Yeah, you're really good. Thank you very much for that beautiful presentation. I love
it. It was easy. I had the information in front of me, but I love Yolexis. I feel like Rocky, Yo Adrian. That's what I felt like with you. That's why I kept Yolexis. I kept thinking the Rocky movie. He was yelling out for her. But anyway, so when did you come here? Now a little background, and then we'll get into what you do with the Department of Health. And we have so many friends that we have in common. I'm in Boca, you're in West Palm, everybody's scattered. Now, tell me, how long have you lived in this country from Cuba? And where in Cuba were you from?
Yeah, I escaped the island in 2013, and then my first time here in the States was in Buffalo, New York, and then after some time there, I just decided to move down here to Palm Beach County, and well, I did so many things before getting this job, and finally I got to the health department, and it's been almost 8 years since I started working with them.
Now, what is your background in? Whether and you did you go to college or school in Cuba?
Yes.
Give me some of your background education to take me to where you are now.
Yeah, I have a bachelor's in teaching English as a second language.
A bachelor's in what?
Teaching English as a second language.
A bachelor's in teaching English?
As a second language, yes, in education.
That's wonderful. Well, you have no problems with me here, that's for sure. And so when you came here, though, you had that bachelor's from Cuba?
I brought it here, but unfortunately, as you know, when you come to a new country, you have to do many things until you get closer to something that you really like to do, like what I am doing right now. So I've been doing, I did so many things, like working for Comcast, the Xfinity, the cable guys, working as a teacher in the school, working in restaurants, in the cleaning the floors, and many other things too.
That's what. Do you have a master's in anything though, too, or just a bachelor's in the English? But how did you get into the health department as a care coordinator supervisor? And you said there's only 6 of those. Is that spread out through South Florida?
Yeah, I came here when I came to West Palm. I applied for a position after I had to work in some other places. I applied for a position in found care as an eligibility specialist. They required somebody who was bilingual, who knew English, and of course who knows something about HIV and who cares for the patients and stuff like that. So I didn't know much about this Ryan White program, but I decided to start looking, and I applied for that position, and I got my interview, and I started working for the Ryan White program as an eligibility specialist there in found care. I think it was in 2016, around that.
So as a care coordinator supervisor, what does that job entail? And then I want you to get into the Ryan White part, because with funding, I'd hate to see anything happen with that.
Yeah, basically, we're a team of six care coordinators, and we work we have a clinic in Belgrade, another one in Delray Beach, and another one in West Palm Beach. So basically what we do is to collect the client's information and process all that information to put it into Provide, which is a database that we use for eligibility. And according to the client's financial information, according to the health insurance they have, and whether if they live here in Palm Beach County or not, they're going to be eligible for the Ryan White, which covers up to 400% FPL, which is really high for, it's something adequate for somebody who's in need of health insurance and something like that. After that is completed, after the eligibility is completed, basically we try to help the clients for all the programs that they qualify for. We have several programs with the county and with some other agencies that can help the clients. So when they are in need of any of those services, we complete the applications for them and stuff like that.
Being bilingual should be extremely helpful in South Florida, especially where we live. And I would think your background comes in extremely, it's very beneficial. So in other words, though, a care coordinator, specifically tell me again what that you do.
Okay, so let me give you an example so that I can better explain how it works. So for example, somebody is newly diagnosed, and after they make contact with the EIS and the DIS, they are brought to the clinic for the test and treat, which is the first step for the client to be in care. So when they go through that program, the test and treat, they receive some medicines and stuff like that, but they will need something that can pay for all those medications and treatments which are really, really expensive. So for that is the Ryan White program. This is a federal program that is county administered. So with those funds, they go through that eligibility process in the one they have to demonstrate their finances and whether if they have or not health insurance, and then demonstrate that they live here in Palm Beach County. Because as I previously said, this is county based. So after that eligibility is completed, then the client is going to be eligible for several services under that eligibility, like for example case management, oral health. Sometimes it can be medical transportation, medical nutrition therapy, and some other services. So if they need any of those services, so we complete the applications, the referrals for them to have those services.
So you pretty much start at the beginning. They come in, and they would come in where? To the health department?
Yes,
You're the Department of Health. I mean, your job is with the Florida Department of Health, correct?
Yes, it was almost 8 years ago when I started with the health department. But before that, I was at Found Care.
Found Care, okay.
Yes, it's a non-profit. I mean, a private one.
But in other words, people have to go through the process of getting tested, getting involved, and go filling out papers and then getting their meds. So you kind of make sure everything flows well with the person, and that all the services they're supposed to get, you work with them one-on-one to make sure that they are getting what they need in a timely and beneficial. Because again, housing, transportation, we're dealing with so much here for people sometimes who have nothing, that to have someone like yourself be able to coordinate and put all of these loose ends together to make this person feel like they have.
Sometimes they come and they have insurance. For example, when they're newcomers to the country, and sometimes they have Medicaid, but that Medicaid is temporary Medicaid, and then they have the meds through that program. But then when that program ends, they have to come again, and then we enroll them in the Ryan White eligibility and make the referral so that they can have the meds at a different pharmacy, but they will not stop having their meds.
Because that's really important, that you, as a coordinator, you put everything together and make it serviceable for people.
That's correct.
That's what you do. And I realize that I'm looking at myself here and realize I'm going to go out and go back on the link. So we'll just keep talking. So we have that, but I'm kind of frozen. So I'm going to go steps. You go through a lot of steps and then you put it all together. Do they continue to see you after this? How does that work once they've seen you?
Yes. I mean, the eligibility has to be renewed every year. In the past, it was for only 6 months, and every 6 months they had to come to renew. But now, since I guess it started in 2020, I guess, or 2019, I don't remember exactly now. Then the eligibility was started being valid for a year then. So if they don't have any changes, they will just come for the doctor's appointment and stuff like that. And then if they need any services, they're gonna consult us. If they need bus pass, for example, if they need to make a referral for any of the services like housing, like EFA, emergency financial assistance, like for a phone, for any of the services that we help them to get enrolled. So they will come and then we will do the paperwork. The same thing if they have any changes in their income, in their address, or in the health insurance.
And you refer to other agencies within Palm Beach County if they need it. I mean, your resources.
Yes. All
That's
the
so
agencies,
important.
Yes, I mean we work together for the same. So we refer sometimes to clients for another services that we do not provide. So we refer them. They have the service, and then they come back with us.
Now, what are in today's environment? And Palm Beach County is so big, so diverse. What are some of the challenges that you're up against right now? I know with the Ryan White, I just with the funding, but what do you see personally in your position that is challenging and not keeps you up at night, but definitely causes you to do some homework?
Well, one of the biggest challenges is to make the clients aware that they need to have their meds, and they need to come to renew their paperwork so that they don't stay behind with their medications, so that they can keep undetectable. They can be undetectable, because U equals U, so it's undetectable, untransmittable. So that is one of the biggest challenges, because sometimes they get the meds through through the concentrate, for example, and they don't want to come to continue with the paperwork, which I understand, because I know they probably will say, well, paperwork is not that important as the medicines. But the point is that that paperwork is the one who pays for those medicines. And sometimes there are some of them which do not understand. So we have a big challenge trying to keep them in to come to their appointments. Sometimes we do field visits, even we go to their doors and knock at the doors and leave and speak with them so that they can comply with their appointments.
Now, with the Department of Health, are you federally funded or state? How do you get the money?
Well, Ryan White has different parts. So that is a federal program. The Ryan White is a federal program, but provide that is the database that we use for eligibility is county administered. So we need to demonstrate that client lives in Palm Beach County, so that that person can receive the services.
Yeah. Do you think the challenges we have here in Palm Beach County are the same as in other parts of the country? Or do you think because of the dense population and demographics that it is more challenging also?
Everywhere is different. I remember when I was living in Buffalo, New York, they had a lot of possibilities in housing and stuff like that. Here in Palm Beach County, we do have some services regarding that, but unfortunately, it's not enough. It's not enough yet, because we have really high population, and we have people coming every day, moving here every day. Everybody loves the palm trees and the beach and the sun, and especially people who live up there in the north. So like you in New York, and like I live there too. So we know we know what the snow is, and honestly, we really love this warm climate here, this weather, and that's why
Well,
we have more people here.
I've been in the South though for 50 years, so from Gainesville to Houston, and 40 years in Boca. So I'm definitely, but I've seen the changes. I mean, Belgrade is Belgrade, Jupiter is Jupiter, Delray is Delray. We're a very diverse Richmond County, and I think that challenges people also, as you said, transportation, housing. What is the big other? Is funding something that is concerning to you also for the Department of Health?
Sure, funding is one of. I mean, without funding, we have nothing. So right now, I mean, we're having some uh, problems with that too. So definitely, funding is crucial to keep up with these programs and to keep up with the services that we provide too. Unfortunately, I mean, without that, without the money that we receive, any of these things is going to be possible.
Yeah, and as far as the medications, they can apply through the Ryan White Foundation or if they have Medicaid, because the meds are so very expensive.
Yes, I mean, Ryan White is payer of last resort. So, for example, if any client comes with health insurance, so that those meds and that treatment is going to be charged to the health insurance. But if the client doesn't have anything, then Ryan White is the one who's going to provide that. So we make the referrals for ADAP, and ADAP is the one who's going to who's going to provide the medications to those clients. So there is something else. I mean, for example, if any client has any health insurance through their employer, and that employer accepts a third-party payment, we can make the referral for ADAP, and they may qualify to, may qualify to receive the premiums for that health insurance, which is something like this. It is 100% win to win. So they can have that insurance because Ryan White is going to cover everything that is HIV related, but it's not going to cover some other problems which are not related to HIV. That's why it's so valid to have that health insurance in hand.
And you have some clients that do have insurance, private insurance.
Yes, we do have many clients who have insurance,
Well,
which is and when it's open enrollment, we also provide the clients to be enrolled. Everybody who's I think they lower now they lowered the FPL, but they need to meet at least the 50% FPL so that they can qualify for that. I don't remember exactly, but I think it's 50% right now. That's ADAP, the one who controls that.
And you have a coordinator that stays in Belgrade and then in West Palm and Delray, or do you rotate around?
Well, unfortunately, we don't have so many to keep one every day in every clinic. So we have 3 care coordinators in West Palm, if I'm allowed to say their names. So we have Mercedes Battle, who's the lead care coordinator. We have Odalis Hernandez, who's another care coordinator, and Susana Salahuddin. They work in West Palm. And on Wednesdays, Mercedes visits Belgrade, and she works there in Belgrade for the clients in Belgrade. But we also work remotely with the clients. If they have, for example, if a client comes another day that is not the day when Mercedes is there, so we can receive the information through the email, and then we can complete the work. We can do the telework remotely. We can work from West Palm and at the same time assist the clients from Belgrade.
Now, as a supervisor, how many people do you have under you, let's say?
Five care coordinators, yes. The other 2 care coordinators are located in Delray Beach. As we have the majority of the population we have there is Creole speaking. We have 2 Creole speaking care coordinators there. One of them is Merlin Breslier, and the other one is Marie Carla Lovinsky. So they work there and they do the same. So sometimes if we have any let's say we have more clients and they need help, then we make the rotation so everybody helps each other.
That's wonderful. What do you like the most about your position, your career at the moment? What do you really like the most? The fulfillment, because I can see it in you and around you. You enjoy your work.
Yes, I do enjoy my work. Yes, I love my job. That's the truth.
Tell our audience why. What do you really like about it, and what brought you to it? What is it about?
Well, I guess there's nothing more comfortable than when you see somebody who was feeling like that was the last day of their lives when they found out they were HIV positive. And when we give the counseling session, we speak with them and we explain how is everything, and we give that little hope that they need. I have so many stories about those clients, and when they come back later, maybe 6 months, maybe 3, 4, 1 year later, and it's a totally different person. And they
Right.
come and they say hi to you, and they greet you, and they say thank you. And well, I guess there's nothing more comfortable than feeling that, having that feeling. That is the truth.
You're giving quality of life to people who maybe felt like they had none.
That's true. Yeah.
I mean, as time's going on, it's I keep using the word marginalized, but HIV is a stigma, and we're trying to remove that stigma and get people the help and the resources they need through this platform, this program we have, because the stigma is real, mental health is real, and you want to get to somebody before they're really going to do themselves in. But that's the point of this platform that we have with Campbell Health and myself, and getting people like yourself on. We help show, we allow people such as yourself to tell us what you do, why you do it, where are the resources, how they can get what they need. It's so important.
That is true. The other thing that I really enjoy is whenever we have any type of challenging situation with the client that is in need of something, and we try to find which is the right program we need to apply for, we need to make the referral to, so that that client can be helped. I also enjoy a lot when I go to my team workers, and I help them to find that solution when we meet, and we discuss the problems that are affecting us, and the new updates, and we work together in harmony like a big family.
Yeah, there needs to be tremendous communication, literally, because you're dealing with life,
That's
real life and death. So you have to have tremendous communication. And the Department of Health is big. I mean,
it is.
it's
It,
huge. And especially Palm Beach County Department of Health. You got all these layers and layers and layers of stuff. So you have to have good communication. You have to have a good rapport with your workers. So how are the other people that you work with? They're good. You'll have a meeting. How often do you all meet?
well, we have a meeting weekly. Every Monday we have a meeting. But that's with the team only. I'm just talking about our team meetings. Every weekend, I mean, every Monday we have a meeting in the mornings, so we can discuss about the last challenges, and the last updates that we have about the program, about any of the services that we provide, or any other thing.
You know all the different areas in Palm Beach County with HIV, the layering, as we use that term. And would you say what is the biggest problem for people in Palm Beach County that they deal with who are HIV positive? What is their biggest challenge with? Is it transportation, housing, getting medications? I mean, you can't take your meds if you're on the streets. So what do you find there? Because we're trying to get that stigma reduced and get people the help they need.
You have mentioned them; those are the ones. Since we have a really high population, we have a big need of housing. So unfortunately, the county does whatever is possible, but we don't have that enough, because we have a high population which is growing every day. So transportation is something that affects us too. But we do have the bus passes, and we're working on another project that is not ready yet, but it's going to help the clients too. So sometimes when clients are homeless, they don't have a phone. So but if we can locate them, so we can complete a referral for them to have a free phone. So by having that phone, we can make contact with them and make the reminders for the appointments, and go after them so that they can come and comply with their appointments and their meds.
Well, but the challenge is you need to be the kind of person you are to be able to network the people to where they need. Because just necessarily like your phone number, we're going to be putting your information on the screen. But to have the Department of Health, as large as it is, it can be overwhelming. And you get an HIV diagnosis, let's say in Kansas, and you move here to Palm Beach County. Where do you begin?
Well, that's a really good question.
Oh, thank you.
Unfortunately, the database that we work with, it's I mean, we use it here in Palm Beach County, and there are some other counties which use it too, but not everybody. It's not a database that is federally used. That is, I'm talking about Provide. There is another database which is called Kware, and that is by HRSA. So that is a federal one. But there are some places which do not use that database. So as we have those problems, not problems, I mean, we do not share the same database for the same process. So if somebody is moving from another state in here, so I will always recommend to have at least proof of HIV. If they have that, or or any lab or something, if they have that, they simply make contact with us, and then we start the process right after. But there is no transfer. We do not make transfers. So new eligibility needs to be completed. We need to register the client in the databases so that they can have access. But the client will always have the services.
So there's not one big national database for this.
As I've been telling you, I mean, this database, Kware, is a federal database, but not everybody uses that, because Provide is a database that is really accurate for that eligibility. So we're using that database instead of Kware. We just update the information in Kware, but that is not the main database. So there are some other counties and states which uses Provide, and other ones which uses Kware or any other database that we are not aware of.
Yeah, that's true.
There's no communication between them. I mean, I'm sure it is for to keep the confidentiality and stuff like that. For example, if there is a client who's registered under Found Care, and that client doesn't have any business open with us, with the health department, even though we know the information of the client, we're not going to be able to find them in the database unless a referral is done for us to see it. That is, just to keep the confidentiality and privacy.
But those words are so ridiculous today. I understand the principle, but it doesn't work. There is nothing confidential, and there's nothing private. There's no privacy. I mean, it's just a free-for-all out there. So those words are just, they have to do it. But, I laugh at it when I see it. But something with HIV, I mean, this is very serious. People are stigmatized when they find out, and they're also shunned, or they don't have any place to go. So, I mean, how do you have to handle it very carefully?
Exactly. I mean, there are some clients who, they understand that, and they accept it, and they don't have any problem with that. I mean, they can tell you, yes, I do have the virus, and I am HIV positive, whatever, and then they won't have any problem with that. But not everybody is the same. I mean, I have had some cases in the one it is a husband and wife, and then it's the husband or the wife who's positive, and they don't want their partner to know it. So we gotta keep confidential about that. And there are some other clients who they do not believe they are HIV positive, and they may think it's a voodoo, or or something wrong, that the test is wrong and stuff like that, or sometimes when you go and see them to try to bring them to the clinic, they say that you're a scammer, that it's not true, and stuff like that. So we have a lot of challenges on that too.
What is the address for the health department in West Palm Beach? You're mostly in West Palm, though, all the time, right?
Mostly in West Palm, but sometimes in Delray, and sometimes I go to Belgrade too.
All right, so there's three areas that they have coordinators where you could be, but which is the main one?
One is West Palm, which is located at 1150 45th Street, West Palm Beach, Florida, 3340507. I don't remember the zip code. I gotta take a look at it now.
But the big health department is up in West Palm Beach off of 45th Street.
Yes, 1150 45th Street, West Palm Beach.
Now, the other thing is, what do you do when there's no phone? As you said, there's no phone, they have no computer, they don't have anything, and they come. Health departments are the first place everybody should go anywhere. I mean, it doesn't matter what state. Go to your health departments if they have one. If not, make sure they have one. But what do you do when you meet a client who's come to you and you have no way really of communicating with them? How do you go about doing that?
Okay, so if a client comes and then it's in need of medication, stuff like that, then we have a program that is called Test and Treat. So they come, I put the client in contact or with the Test and Treat representative, and then they start doing the initial intake, and they will give an appointment to see the doctor, and then they can even go pick the client up and bring him or bring her to the clinic. And after that is completed, then they will return them. And they will also provide with food, and we will do everything possible to register them in the different social programs so that we can continue helping the client.
And what was that called that you said in the beginning? When I asked you about they have no communication, what was that program, or what did you say?
Test and treat.
Test and treat.
Test and treat.
Wow. That's what the health department, test and treat.
Mm-hmm.
Oh, that's a wonderful program.
It is. Right now it's the EIS, the one who's completing the test and treat. So they do both, and it's good because the EIS is the person who goes and see the client and interview the client and bring the client to the clinic. So by having those two programs together, the test and treat and the EIS, so everything goes faster, and it's really good.
And what is the recidivism as far as you see clients? Have you seen some clients year after year, or does it drop out? How does that work with you?
Well, they need to renew the eligibility every year, so they will have to come to the clinic every year, yes, to renew. But there is another way. If they want to do everything over the phone and send the information over the email, so yes, they don't need to come exactly unless they need something to be referred to.
But they need to check in once they're going through all the layers and they've gotten to a care coordinator. Mm-hmm. Then they have to check in with you or one of the other supervisors to be able to continue getting what they need.
The care coordinator is going to keep track, and it's going to give follow-ups, goals, and stuff like that. Yes, but they can also call the care coordinator, no problem. Anytime they need any help, they can call the care coordinator, and then we will do everything possible to help.
And as far as medications go, the doctor's there, so they're able to get their medications through the Ryan White if they qualify, if they don't have insurance, or through Medicaid. And do you see that the medications have certainly, and PrEP, let's say, have kept the viral suppression load down where people are undetectable and transmissible? You find that's been very exciting to have medications like PrEP?
Well, of course, that is a really important program. It's not the one I work with exactly, but yes, I can see in the graphs, in the graphs that we see in our meetings, how are the numbers, so you can compare about those, how effective is that program too.
Yeah, it's come a long way, hasn't it? And as far as the stigma, how do you think, I always ask my guests, we're in the year 2025, and I've been involved with this issue since 1981. how do you see where we've come in this year through 40 years of HIV? How are we doing with all this other than medications? How are we doing with stigma and LGBTQ? And I mean, how do you think we're handling all this?
If you take a look and make a comparison since it started in the 80s and 90s, then I mean, when those protests that they had, I mean, to have the meds and stuff like that, if you see how easy it is now to get the medications and to be protected, I mean, it's a giant step. Nothing is compared with what we have now. I mean, when it started, there was no med for that. I mean, so many people died because of that. And even though you were rich, because we have the clear example. I mean, because money will not buy you health, because there was no med for that. So right now it's totally different. I mean, they have been reducing, I mean, the amounts of pills to 1 to 2, and even a shot.
A shot.
So I mean, everything is totally different. It's a huge step, and I'm sure. I mean, I'm sure that in any moment we're gonna find something that is gonna be definite. So that is, or maybe we're going to do our best, and we're going to continue doing our best to keep them undetectable, so that they will not transmit it.
What frustrates you the most?
Well, my biggest frustration is these people who are HIV positive and they don't want to come to be helped. That is my biggest frustration, and they do not see the biggest efforts that we're doing to keep them safe.
And what about people who don't get tested and they don't even know that they're carrying the virus, that they're spreading it to other people?
Yes, that is a hard one. Yes, we do. I mean, the prevention department does a lot of activities to I mean, to give shots, to deliver condoms, and to test people so that they are aware of their status. Yes.
So one of the big frustrations, tell me again that frustration.
Yeah, I mean, people who even know when they are HIV positive, and they do not see the biggest efforts that all these people, all these agencies, I mean, these governments and this country does to help them, because this is something unique. This is not something that we do have everywhere. This is something from this beautiful country.
Yeah. It's very challenging here in this country. And I'm saying, the reason I love this program and have a platform like this is because I believe that unless we have better communication with the HIV/AIDS community and organizations and take the barriers down, do you think that HIV is going to come back in more of a resurgence because of complacency, where people aren't talking about it, the media doesn't cover it, and it's no big deal, take a pill, you'll be fine? Do you think that HIV is going to come back more?
Well, we need to give more education to people. We need to let them know that it doesn't have any face, that it can be anybody, and the best way is to protect yourself. So, I mean, to explain to them that being tested, it's not an offense. It's something that can help you survive. It's something that, I mean, that if you are positive, you're gonna be detected on time, and whenever we have time, there are some things that we can do. If it is too late, unfortunately, it's gonna be harder.
And what about, though, as I said, with HIV? I mean, we live in Palm Beach County, South Florida, very heavy with HIV. Is HIV on the rise, would you say, increasing?
Well, as this city is growing, yes, we do have some numbers which are going higher. But if you take a look at the percentages, I mean, it's not that big difference. If you take a look at the percentages, if you take a look at the numbers, yes, but it is because also this city is growing all the time, so many people are coming.
Yeah. And it's just amazing, though, that it's true. Percentages are not numbers. And the percentage of people who are, let's say it's Latinos or it's Hispanics or it's Black,
And,
the percentage, I mean, are white.
and that is something else. That is something else. There are many people who are coming from many other countries, and they are already positive. So that's why the numbers are going to be high too, because they were positive already.
Yeah, and it's hard with other cultures. They're not going to put condoms on, or they're not even going to get tested. They're just cultures here are very diverse. I always use Kansas as a thing, or let's say Idaho or Iowa. You know, when I look at Palm Beach County in South Florida, I see the world. When I look in Idaho, I just see snow and mountains, and
It's different, yeah.
it's different. And to get to people here, to even get into a health department, must be very challenging. How do you go up to somebody?
Yeah. Battery is about to die, so we'll have to switch to the phone. If I mean, if I leave for any moment, it's because I'm switching to the phone.
I don't know what you said, but it sounded wonderful because I love your accent.
Thank you. Yeah, I was just saying that the computer's battery is about to die. If I disappear, it's because I'm switching to the phone.
Oh, we'll see this as a thank you. That's my cue. I just want to say, Yolexis Pina Ramirez, thank you so much. And, you know, my best friend, Rob Scott and Richardo, it's like one big family here. We're all trying to do our part. But thank you so much for being a great guest.
Thanks to
you. And we'll let you know when your segment's going to air. And I just want to thank our listeners and our people who support here. And I know that that we're growing and we're reaching people all over the country because we do have a positively positive platform that is our podcast. And so thank you all for watching. Thank you for being an amazing guest. And you have been watching Positively Positive with Susan Mintz. And I'm always going to be committed to love. How's that? We may have a few seconds extra or we may not. You might get dropped. I might get dropped. I'll be seeing you soon at some event somewhere.